Unit 4 Assignment, Surgical Instruments by Function and Procedure by Corda White. Hello, my name is Corda White, and today I will present an overview of an open inguinal hernia repair and highlight 4 key instruments used during this procedure. An inguinal hernia occurs when part of the intestine or fatty tissue protrudes through a weak area in the lower abdominal wall. The goal of the surgery is to return that tissue to the abdomen and reinforce the canal to prevent recurrence. This procedure is typically performed when a patient experiences a groin bulge or discomfort that can worsen with coughing or lifting. Also, if there is a risk of the hernia becoming trapped or strangulated. Key anatomy includes inguinal canal, the hernia sac, nearby vessels, and nerves. The surgeon begins with a small groin incision, carefully isolates the hernia sac, and reduces the contents back into the abdomen, reinforcing the weakened walls with mesh, and finally closes the incision in layers. For this presentation, I selected 4 instruments: the Bocchi tissue forceps, Sen retractor, Brown-Adson tissue forceps, a Youngkower suction tip. These tools provide gentle tissue handling, clear visualization of the operative field, and an efficient wound closure. The Bocchi forceps fall into grasping and holding category. Their fine serrations allow the surgeon to handle delicate tissue in small vessels without causing trauma. During inspection, the tip should align perfectly and the serration should be free of damage. Sen retractor. The Sen retractor is used for superficial retraction. One end is a small rake with a blunt or sharp tips, and the other end is a flat blade. During sterile processing, the sterile processor would inspect the rake prongs for straightness and the blade for burrs before sterilization. Brown-Adson tissue forceps. The Brown-Adson tissue forceps provide a secure grip on skin and subcutaneous tissue, which is specifically helpful during wound closure. Proper inspection ensures that the fine teeth is interlocked evenly and the spring action is smooth. Youngkower suction tip. The Youngkower suction tip is a rigid curved suction device that removes blood and irrigation fluid, keeping the operative field clear. The lumen must be flushed and checked for any cracks or obstructions before packaging for sterilization. The Youngkower suction tips falls under the suction aspiration category. Instrument care and sterile processing. Immediately after surgery, instruments are pre-cleaned to remove soil and waste and also to keep them moist. They're then washed with enzymatic detergent, inspected under magnification, and sterilized. Each of these 4 instruments has specific checkpoints, from verifying the Bocchi tip alignment to ensuring a clear Youngkower lumen. In summary, open and inguinal hernia repair restores abdominal wall strength and prevents complication. The Bocchi forceps, Sen retractor, Brown-Adson forceps, and Youngkower suction tip each play a very vital role, from gentle tissue handling to maintaining a clear operative field. Careful cleaning and inspection by sterile processors keep these instruments safe and effective for every patient. References. These sources provided the information and best practices used throughout my presentation. Thank you.